Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. As we told you at the top of the show, we are talking about leprosy. Now, some of you younger people may not know exactly what this is, and some of you older people may remember leprosy mentioned in your study of the Bible. Now, leprosy is typically characterized by disfigurement, and it's very, very painful, and amazingly, it continues to be a problem today. So my good friend, Dr. Jitka Lom from ExpressCare is here. We're going to try and address this as gingerly as we can, doctor, because for a lot of people, including many of us here at KUAM, we didn't even know that leprosy still exists in this modern age with modern medication.
And it exists here on Guam. I see probably 3 or 4 cases per year. Most of the people are coming in from the outer islands or sometimes from other countries. But yeah, it's still a disease that's present in the world, ancient disease.
Now, what exactly causes leprosy, or do we even know?
We do. It's a bacteria called Mycobacterium leprae, which is a slow-growing bacteria. Divides every about 10 days or so. So it's a very slowly progressive disease, and it's transmitted through like basically your secretions. So if somebody coughs on you and you inhale the germ or eat the germ like that. And so it's not very contagious, but in people that are living in close quarters or people that are kind of unhealthy to start with, they're not very healthy people, or they're very old or very young, then they may contract leprosy. And it looks like basically, in most people it will look like a patch of sort of red skin, a little bit like ringworm but without the scale, patch of reddish skin, or sometimes it's a lighter color skin. And the weird thing about it is the leprosy affects the nerves within the skin, and so you lose feeling. So there'll be a patch of skin that you cannot feel. You can stick a needle in it, you will not feel it at all.
It's tissue that deadens over time slowly.
The tissue itself is actually still fine. It's the nerves in it that are dead. And so since you cannot feel, then you're more prone to injuries and infections, and that's where, like you mentioned, the disfigurement comes from, because terrible infections will set into that diseased skin. That's how we know pain is actually a good thing. When you feel pain, you realize there's something wrong, you can take care of it. In these people, they don't feel pain, and other diseases will set in.
Can you compare and contrast, doctor, between leprosy and maybe a more modern disease like flesh-eating bacteria? Because, ironically, Jeff Hanneman from Slayer, the former guitarist, passed away last week because he had necrotizing fasciitis, which is a variation of flesh-eating disease. How do those stack up?
That's a great question, because in a way leprosy is a flesh-eating disease, but it's a very slowly progressive disease, meaning that, like I mentioned, the bacteria divides very slowly, whereas in the typical necrotizing fasciitis or flesh-eating disease, that's a rapid disease. So the germs divide very quickly, they eat a lot, they spread very quickly, and you'll get sicker very quickly. So that's the difference.
Now, I'm also amazed at myself. I never thought in my career I was going to mention Slayer and the Bible in the same show. So. Okay, we talked about, is it possibly contagious? What are complications if it goes untreated? Because obviously if you have something wrong like that, you want to see medical professionals like yourself as quickly as you can.
Yes, and leprosy is treatable now. Since about the 1990s, there's been a huge worldwide effort to try to control and to eliminate leprosy from the world. But the complications are, again, if you have no feeling in the skin, injuries and infections can set in, and people basically lose body parts. So if you go around India, you'll see people, lepers, still in the streets who've lost all their fingers, part of their nose, all their ears. I mean, it's horribly disfiguring. And that's the main complication. Blindness is another one. It can settle in and become, it can sort of flare suddenly, and then it can actually kill you. So complications range from minor to death.
Now, quickly before we go to break, of course, people that have studied, fascinating old tales from biblical times, they knew that as far as quarantine, people that were lepers were sent away to the island of Molokai.
Yes, that's true.
What are people today in modern times? What happens if people, quarantine strategies?
Yeah, in these days, this day and age, you don't need to quarantine people. You just put them on 3 drugs for 12 months. Imagine that. In the old days, they would take even a child that had leprosy, take it away from its parents, put it in a leper colony, and that's it. That's where you'd stay. And now you can just be on medication for a year and you're done. So that's a pretty big advance. Okay, well, we are going to talk some more with our Facebook questions, so please stay tuned, everybody. We are talking about leprosy. It still exists today, but the doctor will continue to educate us on this topic when we return.